appreciate the chance to give an update on where we are now. Looks like we're being live streamed now, just in time to share the updates. That's good. Dave, can you confirm you're seeing a full slide?
Yes, with your list on the left as well.
Okay, let me get that switched over then. Right. Okay. How about now? Full screen or notes?
Now notes are there.
Okay. How about now?
Full screen.
Okay, excellent. There we go. Sorry, everybody. And we'll send these out so everybody has them after the meeting as usual. I hope to give you kind of an update on where we are with Omicron, where we are with cases, hospitalizations, vaccine uptake, and really try to provide some information to help people protect themselves and those that they work with, those they love, those they're going to spend time with over the next few weeks as we see this surge in case activity. Mila, we've got about 30 minutes, right, for presentation and questions?
Yep.
Okay, and I'm happy to take questions as we go. So again, feel free to put them in the chat or we can pause kind of along the way. I want to start with Omicron because since the last time we met, we've really seen another significant change in what we're facing with COVID-19. Before Thanksgiving, even Thanksgiving week, we felt like, okay, cases are up a little bit, but we've got vaccines out, we're getting antivirals and more treatment options available. What else is there? And then, as you know, Omicron bursts onto the scene, and we still don't have all the answers that we really need to best understand what's going to happen with Omicron. If you're still doom scrolling like I am, every hour there's some new study that comes out that says it's way more transmissible. It may be similar to Delta. Maybe it's less in 3 weeks. The severity is more mild. Any of the things that are really out there now are still sort of emerging data. I think the one thing that's become more clear is that Omicron does appear to spread very quickly. Who's most susceptible is still sort of being determined. Is it people that have not had any prior immunity? Is it people whose immunity is waning? But it certainly seems to be spreading quickly, and the numbers and the spikes you've seen in different countries is a cause for concern for us, because we know that as cases rise exponentially, some percentage of those will translate to hospitalizations and death, especially in our communities that are most vulnerable, our people that have the most chronic health conditions that put them at higher risk. And so even if severity ends up being more mild, just the sheer number of cases may put us in a position that we really don't want to be in. So all of these questions are sort of in development right now to best understand kind of what the final answers are. I think at this point, it's important to know that it spreads just like any other strain of COVID. So it's a respiratory disease spread through the air, which is why masking, which is why ventilation is so important in reducing risk. And the good thing is that tests continue to identify infection. So you'll know if you're infected, either because you've got symptoms or you're testing yourself before a gathering. We have all of the tools. So again, the biggest answer I think we have for people that say, well, I'm really worried about Omicron. What do I do? 1, get vaccinated. 2, get boosted. Make sure you get that full protection. 3, wear a mask if you're inside around people you don't live with. This is a respiratory disease that spreads through the air. So masks provide protection both for you as a wearer and for people who may be asymptomatically infected or not showing symptoms yet. It helps to cut down the risk of transmission. And 4, that tests can tell you if you're currently infected. So if you have symptoms, get tested. The value of knowing you're infected is that you can then take steps to protect those around you and take care of yourself. CDC has updated just in the past 2 weeks their science brief. So all of CDC's recommendations that are out on the website and that we include in much of our communication is backed up by what they call their science briefs that really seek to aggregate all of the current kind of evidence about those recommendations. And so there's a really good one on community use of masks that I would encourage you to draw from. I don't think these are for everybody. This isn't something I would hand out to the community and say, hey, this is why masks work. But if you're getting questions, if you're not sure why exactly we recommend that masks be worn or why they're so important right now, this is a really helpful tool. And you've got a link in the bottom right corner. And it reinforces the fact that masks work 2 ways. One, by as source control. So somebody could be infected. If they're wearing a mask, they're much less likely to expel those viral particles into the air around them. Masks will help contain it to some degree. Masks also work to protect you as the wearer, reducing your inhalation of droplets or aerosols from other people. And the community benefit comes from both of those things combined. So I'd encourage you to check this out. It addresses some of the concerns about, well, isn't wearing a mask for hours at a time dangerous? Doesn't it affect kids, and isn't it detrimental to their learning? There's more and more evidence that's coming out that's both experimental and epidemiological that shows that masks do work to help prevent transmission. If we want to get back to those lower levels of transmission, masks are something you can do today to reduce risk. Now, in terms of case activity, we've really seen a skyrocketing of cases. We're back up to a level of case activity that we haven't seen since last winter. Yesterday, we had just under 800 new cases reported in the past 24 hours. I drew a red line here just to give you that comparison of where we were. We have not been this high, but for a few days across the whole pandemic. So we're concerned that this rapid rise in cases will translate to some number of hospitalizations and deaths. Certainly, there are fewer deaths and fewer hospitalizations than we've had. But if these numbers continue to grow and surpass where we've been before, we're going to be in a position that we don't want to be in. The age groups that we're seeing identified as cases really run the gamut from 0 to 19, the 20 to 39, and the 40 to 59-year-olds are all very closely associated. So we're seeing cases in all of those age groups. Concerning rises again in the 60 to 79 group. And thankfully, we have not seen big spikes in this 80 plus group. And that's really encouraging right now, because that is a group that is very vulnerable and at risk for serious complications. But as we talk about protecting, those that we spend time with, those that we work with, those that we love, it really is kind of for the 0 to 59-year-old group that's seeing the highest number of cases right now. We are focused, not only on the case numbers, but also the outbreaks. And that's really where we're going to be spending probably more of our time into the future. Is at some point, cases will sort of separate from hospitalizations and death. We'll be less worried about each individual case, more about the context of that case. Are they spreading it to others? Are we seeing outbreaks? So in the past 2 weeks, this is the list of outbreaks that we have identified and the number of cases associated with those. So we are seeing cases and outbreaks associated with school settings. We are seeing cases and outbreaks associated with skilled nursing, assisted living. And we really, really want to take steps to prevent outbreaks in these situations. So this is on our website. It's updated every week. I would encourage you to use this as sort of awareness of where we're seeing spread beyond, 1 or 2 people in any given spot. I'm going to hit hospitalizations and deaths, and I'm going to pause to take some of these questions in the chat. So just know that I'm going to pause here in about 2 minutes. Hospitalizations right now are really the thing that are concerning us really the most, right? So cases are going up. We know that, there's a lot of cases that are asymptomatic. There's cases that people might have a minor symptom, but they feel fine. Unfortunately, we're still seeing a really big surge in hospitalizations. And Illinois right now is one of 6 states that accounts for more than half of the hospitalizations in the country. What's important to know about this is that 3 months ago, this article would have said 6 states are responsible for more than half the recent hospitalizations, and it's Florida, Texas, Mississippi, Louisiana, Alabama. We've seen this case activity kind of wax and wane across the country. So really important as people or you think about, well, this state doesn't have a mask mandate, or they're not doing anything. And look, their case activity is really good. Why can't we be more like them? They may have had a lot more cases and hospitalizations 3 months ago. So important to recognize that these patterns still sort of wax and wane across the country. We are back up to about 12 new hospitalizations among our residents every day. These numbers tend to lag a little bit, so don't pay too much attention to the last few days where you see this decline. I would pay attention to the top of that rise, and as this data catches up, as these are reported to us, these numbers will change. We are much, much better off than we were a year ago. But the rise that we've seen has us concerned. When we look specifically at the 6 hospitals in DuPage, this represents any patient in the hospital for COVID, either on a regular hospital bed or in an ICU bed. And the numbers have grown really dramatically over the past 2 months and even over the past month. We were this summer down to numbers of less than 5 people in the hospital across all of DuPage for COVID, and now we're back up to 234. Our ICU capacities have been under 20% for 11 days. If you work in healthcare, if you have friends or family members who work in healthcare, talk to them, hear what's going on in the hospitals. The hospitals are seeing huge surges, not just COVID, other health conditions. And that's really our concern, is that if you have this many people in the hospital for COVID, something that's generally preventable through vaccines, it's going to impact the care you may receive for other conditions. We need to get COVID under control so that we can take care of people and the other conditions that they have day to day. Our hospitalization numbers, if you look at the right side here, we're back up to 240-ish. Our peak last winter was 380 patients in the hospital. So we're really concerningly on this upward rise. We're not seeing this complete separation of cases and hospitalizations and say, well, you know what, we can ignore cases because there's not that many hospitalizations. There are a lot of hospitalizations and ICU hospitalizations for COVID in DuPage County right now. When we look at deaths, what's really good to know and encouraging to see is that the number of deaths has remained relatively low. Now, we know deaths tend to lag and the numbers lag 2 or 3 weeks. So when cases go up, hospitalizations go up, deaths generally go up. So we're not ready to say that, hey, this isn't the problem. We're not seeing a rapid rise in deaths. We had a period this summer where we had no deaths reported for 3 weeks. And now we're back to 1 to 3 deaths being reported a day. And that gives us concern because, again, this is generally a vaccine preventable illness and nobody should suffer this severe outcome related to COVID. I'm going to pause there and stop for questions in the chat, or if you want to unmute, feel free to do that. Dave, do you want to facilitate questions?
Sure. Well, with Mila's help, I can think of 2 that I've grabbed hold of. One is the question about Omicron in DuPage. Has there been a confirmed case?
Not yet. So cases, when people test positive, some of those samples then go on for sequencing. So there's a little bit of delay. You won't know exactly, as soon as you test positive, you don't know whether that's Omicron or Delta or some other strain. So there's a little bit of a lag. But no, we have not learned of an Omicron case in a DuPage County resident yet. We will. It's here. You're seeing it in many other states and seeing significant rises. So it's really a matter of, when we see it, not if we see it, but nothing yet.
Thank you. And from Sarah, the question, any word if kids will need or when they'll need boosters? She's receiving questions from parents, lots of questions, and haven't seen much. And she specifically says the 5+ age group.
Yeah, it's a great question and one we don't have an answer to yet. I think we'll be watching, the medical community, science community is going to be watching those 5 to 11-year-olds that just got vaccinated, certainly following those in the trials that got vaccinated first to see what their protection looks like. Certainly in every other age group, it appears that, this may be a 3-dose series spread out over a period of time. We've seen that immunity wane in those age groups. So it's possible that those 5 to 11-year-olds might need a booster, but we don't have a clear answer yet. The good news is that the protection from 2 doses seems to last for a number of months. And so anybody that just got vaccinated or just was fully vaccinated this month should enjoy protection for a period of time here and get us through the Omicron wave.
Thanks, Chris. And I'm going to restate one of Sarah's questions. Sarah, I hope this is helpful to you and to the group. Parents are saying, oh, well, with Omicron, we're going to wait until that specific shot is developed. What's an answer there?
It's really important to get that protection now. The rises in cases and hospitalizations we're seeing are likely associated with a number of Delta cases, other variants, and we really want to protect people from what's here now. The vaccines also have been shown to work against Omicron. So certainly there may be an Omicron-specific booster or vaccine down the road, but I would not want to take that risk with my own children to say, well, I'm going to wait until it's available and get them through this wave. We know this is a period of intense sort of gatherings. People are going to be spending time together with people they don't live with indoors at a time when there's a lot of case activity. So we would absolutely recommend that people get vaccinated and boosted at the earliest opportunity.
Thanks, Chris.
I might add to that, we need to understand too, that Delta is still very significant in what it's doing to our communities. And then I would ask if you could just explain what you mean by sequencing. And I ask that because there are people who believe that every COVID positive test is sequenced, and we know it's not. So if you could elaborate on that. And then one final question, are we going to see more testing centers opening?
Good questions. So with the first one, kind of your statement, yes, most of what we're seeing is still Delta. CDC has a page. I didn't include a graph. I can go back and grab it later. That shows that over 97% of the specimens that are sequenced are Delta. Now that takes a little bit of time to catch up. So we know Omicron has grown. In the past 2 weeks, Omicron samples grew from half of what was sequenced up to 2.5%. So it's jumping, and I would be, watching that with a careful eye. On the question of sequencing, so sequencing, what happens when somebody tests positive with a PCR test or a rapid test is that test is looking for, the virus itself. It just tells you if you're positive or not. Is there virus there or not? The second step of viral or genomic sequencing is to take that sample and really look carefully to understand what strain of COVID that is. What specific characteristics does that virus have? And we'll tell you, is that Delta? Is it Omicron? Is it Alpha? Is it one of these other variants? Only a percentage of the overall all tests go on for sequencing. I honestly don't know what that number is across the country. We've gotten varied answers. CDC director has been out saying about 17% of all samples are sequenced. We've heard other numbers that are closer to 5 to 10% across the country are being sampled. So it's not everyone, and it really doesn't need to be everyone because it doesn't materially change our treatment recommendations or what you would do about it. So it's helpful surveillance to know what's here. But I think most important for people is to know if you test positive, it doesn't matter what variant it is, take it seriously, watch your symptoms. There are treatments available, the monoclonal antibodies and more antivirals coming that will prevent you from needing hospitalization or other care. Jan, what was the third question?
Are we going to see more testing centers opening? And as long as I'm in voice now, I just put a question in the chat because a parent texted me yesterday wanting to know what is the best home test.
Yeah, so I'm on the testing question. I'm interested to hear from all of you, what your experience with testing is. Certainly there's a lot of testing available, but I think in the next few weeks, it's going to be harder to get. So we don't have immediate plans for more test sites. Certainly the health department site in Villa Park at the Odium continues to be available. We see about 100 people a day. That could scale up much more. So we want people to know that's a place you can show up. You don't need an appointment, a doctor's order, any pre-planning. You can certainly register ahead. That'll make it speedier on site. But that's a really important option to know about. Walgreens, CVS, pharmacies will take appointments online. I know that it's hard to get same day testing appointments, getting my kids tested. So we would encourage people to, think about those options. If you need a test tomorrow, there's probably plenty of appointments available. If you need to go today, the IDPH testing sites, the one in Aurora or our site in Villa Park at the Odium are good to just show up. But I'd be really interested to hear from you all about access to testing. Is there enough? Are there gaps? Where are they? Is it just knowing that they're available? Is it knowing how to access them? That will help us to make, informed decisions about more testing. So feel free to drop that in the chat or we can talk about it later. In terms of best home tests, I don't have a best. I think any at-home test that FDA has approved for testing at home are effective. And I wouldn't necessarily rank them. And you can buy those at pharmacies. Walmart tends to have the cheapest. The Abbott Buy Next Now I've seen for $14 for 2 tests. That's still a lot of money. And there are plans for wider distribution of rapid tests. The federal government has continued to say they plan to make those available through FQHCs, through food pantries, through community organizations. I haven't seen enough detail about that to really feel confident right now, but I know that that's a strategy that's in development. And Evan, I see an antigen test is effective at detecting Omicron. Yeah, so far the indication is that the antigen tests continue to identify Omicron. There are changes in the Omicron variant that make it, that change how it's identified on a PCR test. But the antigen tests, so far, we've seen that they continue to identify Omicron strains.
On the testing, the private labs or storefronts that are doing testing, how do we know? Some of them appear shadier than others. Some of them look professional, but they don't appear on the health department's website. How do we know what we can trust? That's
a great question. It's really hard to know. There is very little regulatory oversight for these sites through the state. So long as they have a clinical director, they're allowed to operate and a CLIA license. We have followed up on several that we've heard concerning stories from patients. I got the wrong results. I never got a result. I had some question that didn't get answered, and we've submitted those for formal investigation of the state, and honestly have not had action on those. So Evan, as a municipality, I think knowing if you have those operating in your town, really thinking about whether you have a mechanism to deny, if there are issues or of issues, that there's a way to take action at the local level, because at the state level, they're really not taking action on these. So what I would recommend is that if people are looking for test sites, or you're promoting test sites, looking for ones that, look like a test site, smell like a test site, are affiliated with a reputable source. So the IDPH testing sites that are available, certainly our DuPage County Health Department site at the Odium, healthcare providers like Edward Elmhurst, DM Dooley, Amita, are really your best options. Not to say that some of these pop-up ones are terrible, but we do know that there are issues with some of them.
I would actually kind of flip that back on you, Chris. Just like you guys regulate our restaurants and stuff, I don't have the staff and I don't have the equipment to know how to regulate a testing site. That's to me, that sounds like a public health issue. And so I would encourage and urge you guys to help certify these or make recommendations, check them out or something, because it does fill a gap. I mean, I'm looking at testing my own staff, and I can't get into CVS and Walgreens, but TriLab, which is in my town, they'll willingly do an antigen test and a PCR on the spot, just walk in. So knowing that that's good or that's not good would be beneficial in my decision making and protecting my community.
Yeah, we'd be happy to work with you guys. Maybe that's something we can work on with mayors and managers, is like what tools, certainly we know from the medical side, what's appropriate and what's not. The tool about like, can you operate physically in this space, in this town, is often, one we want to partner with you guys on, to say, no, you can't have a temporary license to operate here. You need some sort of village approval, but we can work with you 100% on like, is it valid or not? Or are we having complaints that we want to follow up on? Because right now there really isn't anything on the books per se that allows somebody to shut them down unless there's a really egregious problem. And even then it's taking time.
Right. From our stance, we look at it as medical office. So if zoning permits medical office in that district, what are we to do? They're apparently providing a medical service, just like a doctor's office.
Yeah. That's one I'd love to follow up with you on, Evan. So I'll call you later today and see if we can figure out a way to work together on that.
Perfect. Sounds good, man.
I'd like to say too, my company I've done corporate wellness for the last 15 years. And my company went bankrupt during COVID. So as somebody who has recently been job searching, we all know that there are people who glom onto your LinkedIn or Indeed or whatever and come at you with some kind of MLM or something kind of shady. I had a company contact me who wanted me to sell test kits at home for they were going to pay me $20 for every test kit I could bring in. And it seemed fairly scamish to me. So, I mean, of course I didn't do that, but it is something that needs to be investigated, and there should be are they even testing, or are they just people scamming people and the government in particular, and getting paid for tests that aren't actually being even ran?
Yep. Yeah. So I would, as much as we can encourage people to use sites that, have some vetting, acknowledge there's not a great way, but I think looking through the IDPH website, we link to that from our site, that those are kind of reputable sources. The appeal, of like, hey, there's a site right here, I could pull in behind this gas station and get tested. I get it. And, if you look suspicious, look for something else. And Sarah, I'd love to hear from you maybe after the meeting on specific examples, because we would be happy to follow up. We've pursued a number of these with the state health department, the attorney general's office, and are really continuing to push those to make sure that they're not predatory and really mishandling this information. All right. I'm going to.
Chris, thank you for saying that, because this is what HEART's about, right?
Yep.
Health equity. And we know that West Chicago is a community where we have a significant number of vulnerable people. And if they are being targeted because of language barriers or low education attainment, as keepers of health, in our community. We need to identify these people and get them out of business quick.
Yeah, and IDPH has in the past month, they're starting to explore some other options for community-based test sites that, might be more local. So if it's an organization that wants to, sort of host a test site and, potentially provide some limited staff, there may be some options for that. So if your organization or you think there's a community group that might be able to work together to offer that, we'd love to figure out how to get, test supplies and potentially reimbursement to that. There may be some options. So if Sarah in West Chicago or other areas, we'd love to look more at these choices to get people better quality test sites.
Chris,
Yeah.
can I ask a question maybe of Sarah? This, I don't want to take us offline here, but it seems like, Sarah, one of the issues you identify is enough information to push back. Would it be helpful for consumers or neighbors in the community to have a sheet that says, if you're not getting satisfaction through your testing place, you have the ability to do this, this, and this, that has equipped them to push back so that perhaps those sites that are doing a good job can be responsive instead of just continuing to be a mystery?
I think that would be great, Dave. And some, a bilingual sheet that just says like, these are the good things to look for in the test site, or I know you all have that on your website for the list of sites, but it's hard for us to point people in that direction. So even, half sheets that we can print out and have available, that the schools can have available to give parents, because it becomes a desperation issue. And parents are so desperate to be able to get to work and to get their kids back in school that they'll end up going to multiple sites because they just need a result quickly. And especially at this time of the year, that additional pressure of losing income is just, it's horrific for these families.
Thank you.
Yeah, that's really helpful. And yeah, Sarah, if you can give me the details, that's excellent. Jan, yes, absolutely. If these are the issues that, we don't want these predatory practices taking advantage of people that, we can help get better resources too. So thank you for the input, everybody. That's really helpful. Okay, on vaccines. And Dave, what time do we need to stop?
So let me do a check-in with Mimi regarding the amount of time that she will need for her part. Mimi, can you estimate?
No more than 10 minutes.
Okay, so you got another 15.
Okay, I'll keep moving and I'll pause again for questions, but otherwise try to just give you the highlights and you'll have the information afterwards. So on vaccines, we continue to do really good. CDC has added a category now of over 5 people over the age of 5 and the percent of your population that's vaccinated with at least 1 dose or fully vaccinated. We have over 76% of our population over the age of 5 fully vaccinated and 83% with at least 1 dose. That's incredible. So when you think about all the pushback you hear and well, we've got, people that are resistant or hesitant, the vast majority of our friends, colleagues, coworkers have been vaccinated, and really important to recognize that important step and play up, right? We talk about kind of positive framing for these things. 8 of 10 people in DuPage County have been fully vaccinated. Won't you join them? How can we get you the information to answer your questions? What questions do you have? And again, over 8 out of 10 DuPage County residents has received at least 1 dose for those that are eligible. Now, the thing to know, and I think just sort of flag for you, is that, the question we get is like, okay, great, we've got 80%, but we're still having an incredible number of cases. We're still seeing these big hospitalization numbers. How is that even possible? The reality is, if you look at our fully vaccinated number of 662,000 people, we have 930,000 people in DuPage County. That leaves 200,000 plus people in DuPage that have not been fully vaccinated. Some are under the age of 5 and can't be vaccinated. We know that. Some people have a true medical contraindication or some issue that prevents them from being vaccinated, but we have over 200,000 people that have not been fully vaccinated and continue to be at risk for developing infection, for being hospitalized, and for dying as a result of their infection. So it's still a big number, and we can all work together, I think, to help bring that number down. Vaccines work, period. Vaccines have been tremendously effective around the world in decreasing severe hospitalization and death, and right here in DuPage County. Since last December, when vaccines became available, For the first group of people, we've had almost 3,000 hospitalized or deceased COVID-19 cases, and over 95% have occurred in persons who were not fully vaccinated against COVID-19. Vaccines protect you against hospitalization and death. They absolutely work. Now, those numbers have changed a little bit over time. And I think what you can see in June, July, August, we started to see more people who were fully vaccinated develop severe illness. That's one of the indications that we need boosters, and that boosters will help to return us to a level of protection that we enjoyed before. And so it's important to recognize that they're not perfect, but they will protect you from severe illness and death. You all have seen the booster recommendations have changed several times since the last time that we all met as HEART. So important to recognize and point out to people that there is evidence of waning immunity over time. Boosters are really important. And we've heard from people that said, well, I didn't know I was eligible. I didn't know I should get one. I'm not sure if I really need it. The bottom line message for people is that if you're over the age of 16, you should get a booster, and you should get a booster as soon as you can, as soon as you're eligible. What we saw, this is another way to look at, the number of the gray line on this chart is the percent of our fully vaccinated cases as a percentage of all of our cases. So we saw a higher number of people who were fully vaccinated get infected in June or July, August, September. So there's evidence that our immunity wasn't as strong at that point. Boosters have helped to bring that risk back down. So really important for people to get boosted, especially with Omicron on the scene. CDC has updated their table and information to kind of outline who can get a booster shot. Everybody over the age of 16 can get a booster and should get a booster, period. When we look at our demographics of who's been fully vaccinated, who's received a booster, I think this is an important data set for HEART in this group. It's not easy to break down. And so I regret that. I wish we had some better comparison. What you're looking at on the left is of people who are fully vaccinated in DuPage County, the characteristics by age, gender, and race, ethnicity. When you compare that to who's received booster shots on the right side, anything that doesn't match up closely tells you that there's a gap in those folks getting boosted. And so we know that our 18 to 64 group makes up a huge percentage of our age demographics of those who are fully vaccinated. And yet when you look at boosters, they represent a much smaller piece of that pie. Gender is a little bit better. We have some gaps, I think, in demographics for race, ethnicity of who's been boosted, particularly around Hispanic and Latino populations, those that fit into these other categories that are harder to read on this slide. I meant to put the link, it's behind here. I'm going to drop it in the chat, but I think that's an important one to look at if you work with individuals in these different demographics, to make sure they know they're eligible, make sure they know where to get a booster, and make sure they know how important it is to get boosted. Because we did so much work to ensure that everyone had access to vaccine in the first place. We don't want to now have a gap in boosters. For 5 to 11-year-olds who have been eligible just since early November, the last time we met, I think this was just kind of coming out. And Mimi, I'm really eager to hear about your data. So far, about 36% of our 5 to 11-year-olds have received at least one dose. That's incredible. That's way above the national average. And 22% of our 5 to 11-year-olds are fully vaccinated. There was some issues in November where it appeared that DuPage was doing much, much worse than most of the state. Turns out there were some data issues at IDPH that we really pushed to resolve. And lo and behold, we were doing much better than anybody had reported. So if you saw news stories in November about how bad DuPage was doing, that data was inaccurate. So pleased to say that we rank first now out of 102 counties in those who've received at least one dose. We don't have great demographic data on these yet. So I hope to be able to provide some updates here. But again, we want to make sure that every 5 to 11-year-old, every parent of a 5 to 11-year-old has the opportunity to get their kid vaccinated. The evidence for vaccinating children continues to grow. Right now, COVID-19 ranks as one of the top 10 causes of death for children ages 5 to 11. If you could prevent any one of those, I think you should, and we should, and certainly consider that that is a complication for kids. They're at much lower risk than adults, absolutely, and they have experienced much less severe illness than adults, but it does impact kids, and especially kids with underlying medical conditions. CDC has reported on the number of hospitalizations in this age group. These bars show the 0 to 17-year-olds who've been hospitalized each week. More kids have been hospitalized in the past month than at any point in the pandemic in the past 2 months. And so we know that kids are at risk. Even if they're at less risk than adults, there are more kids being hospitalized. When we look at 12 to 17-year-olds, cumulatively 12 to 17-year-olds who were unvaccinated were about 12 times more likely to be hospitalized than those 12 to 17-year-olds who have been fully vaccinated. So the evidence stands up for kids. Vaccines are widely available. You all know this. And I think being able to filter this vaccines.gov by age group, by vaccine type, should help people find boosters and find them quickly. We're seeing a surge in people looking for boosters. So if you're trying to schedule now, it may be a couple days, it may be a week out. So really important that if you want to get that booster, you schedule it now. Don't wait, get in line, get your vaccine and get that booster. The caravan continues to be an option. So Andy, thanks for flagging that we were able to work with you all this summer. We've been continuing to reach out to businesses, faith communities, municipalities, all over, and we would be happy to partner with you. I think since August, we just looked at the numbers, we've been in 143 different events since August when the van came online. So we are thrilled to be out. Anywhere you think we can partner, let us know. We'd be happy to do that with you. And I'll end on treatment options. One thing that's really going to be important, we feel, over the next 4 to 6 weeks, if we continue to see this surge in hospitalizations, is that there are really effective treatment options available. These monoclonal antibodies are an incredibly effective tool in reducing severe illness and are available in Illinois. There's a lot of work right now to try to scale up this and make sure that people know that it's available and how to access it. It is not easy. I'm going to admit that right here and now. But to start, we need to make sure that we all know that these are available and should be recommended early in someone's infection. So we're doing work now with the state and with our contact tracers to get this information to people more quickly so they know to even ask for it, right? You can't get this if you don't know to ask your healthcare provider. You don't know who to call. So the monoclonal antibodies are distributed to our health systems and some other healthcare providers across DuPage. They need to be infused either through an IV or there are some subcutaneous injections, but they need to be started quickly, at least 10 days within your first symptoms. Or sorry, close to the start of your infection. At least 10 days have passed since your first symptoms. And we want to make sure that people know these are available. There is a treatment finder on the US Health and Human Services website. Illinois is poised to launch. They're working on an Illinois specific tool, but there is a link here to find locations that are administering these monoclonal antibodies. We want people to know that they're an option. And finally, what I'll end on is really the key question I think we've heard and we want your help to get out is, so what can I do over the holidays to reduce my risk? I can't get it to zero. It may not be feasible. What should I do? 1, get vaccinated and boosted now, quickly, before you're exposed. 2, self-testing. CDC has updated their recommendations, and there's some nice language here about using self-testing as one more option to reduce risk before going to a gathering. So you have a greater chance of knowing whether you're the person infected and bringing that to the gathering. 3, improving ventilation. This is a disease that spreads through the air. So improving the air quality makes a big difference. And there's some nice practical steps on this website that I would encourage you to check out. Turning the exhaust fan on the stove, opening a bathroom window, leaving the exhaust fan on in the bathroom, trying to pull more fresh air into a space will help to reduce some of the buildup of viral particles in the air if you have somebody who's infected in your home. And then finally, using masks to slow the spread of COVID-19. We know these are effective and we want people to know that this is a step they can take. They don't need to be told by somebody they must wear it. We want them to understand that they provide protection. And I will stop there, Dave, and happy to take questions or move on at your discretion.
Thanks, Chris. What an incredibly densely packed with good stuff presentation. So one of my habits is to share the link to the YouTube site when these are posted. And there's always a little bit of a lag. So if we're able to share that PowerPoint, Chris, that's a great help. We can, that last second to last slide is the one that should be in everybody's inbox right now, along with a lot of other good information.
David, while monoclonal antibodies is fresh in my mind, one of the physicians reached out to me and said he's available if we wanted to do a virtual meeting open to the community to better explain monoclonal antibodies. Is this something we have an appetite to do?
And I think that's a great idea. Is that
Okay.
something you would want to organize with your current groups, or, let us know if we can help you, but that's a great idea.
Okay, great. Thank you.
Is there a bilingual option for that, Jan? Do you know?
Well, David, I'm sure will make a bilingual option.
Yeah, we can
available.
partner on a simultaneous interpretation. Sarah, have you had that experience of events that have a simultaneous interpretation? And
Yeah.
what's your sense of that? Is it effective?
Yeah, it is, because the Zoom option has where when you enter the room or enter the platform, you can pick your language, and so it automatically divides it. It can be a little clunky depending on the translator, but I've seen it pretty well done. Yeah.
Very good.
So David, it sounds like you, Sarah, and I may work on this.
We're in.
Okay, thank you.
It's a great idea.
Building on that, I think I'm still confused on monoclonal antibodies a little bit. I don't know that if I'm a reasonably healthy mid-30s male and I get COVID and I get the sniffles, do I march on down to Elmhurst Hospital and ask for monoclonal antibodies? Do I call my doctor? Do I need it, or do I rough it out? I don't know when the decision tree, how that works. I think if I don't know it, my residents definitely don't know it.
Yeah, good question, Evan. So it's an important tool to know, for everybody to know exists, right? Because if you don't know and then you're really sick, it is too late, right? So if it's late in your illness and you're trying to get that, there's a nice breakdown of people who are at high risk, people who tend to be at high risk for serious COVID hospitalization, are those over 65, those who are obese or overweight, which is a huge percentage of our population, those who are pregnant, those with chronic kidney disease, diabetes, heart conditions, lung diseases. So this is a list that, may sound like, oh, that's a lot of stuff, but it represents a lot of people. So in most cases, it's something that you should investigate, if you are at high risk and you're at high risk, or if you are developing illness that is progressing beyond, if you're asymptomatic, no, I would not recommend that people go find monoclonals. If you're sick and feeling ill, this is something to investigate to keep you from getting even more sick. So I think we have more work to do at the health department to make sure people know what these things are. I know we've got more work at the state level to make this easy for people. States like Florida doubled down on this early on. They said, we're not going to worry about vaccines or masks. We're just going to make MAB widely available to people. We can argue about that strategy, but they've made it incredibly easy for people to show up and get MAB at a walk-in appointment. States like Colorado, Washington, California are expanding access now. So I think it's a tool that we had not previously taken enough advantage of because our case numbers were low and our hospitalizations were low when these came out. Now we're seeing this massive surge and recognizing that we really need to have this tool available to prevent those that we care about from getting really sick.
So is that a decision that you make as an individual, or you make in concert with your physician? Like, so if one of my friends gets COVID, should I say, go to the hospital and get monoclonal antibodies, or should I say, call your doctor and see if you should get monoclonal antibodies?
Both are the right answer, because what we're finding is that even some healthcare providers don't really know how this works or how to refer somebody. So if you ask your doc and they say, or your healthcare provider, and they say, yeah, I don't really know enough about that, or yeah, I know it's out there, dead end. If you know that you can advocate for yourself, or we as organizations know that we can advocate on behalf of our residents, our clients, our friends, it ups the likelihood that we're going to get somebody connected to this.
Yeah, I think we need to do more work on that. But just because I think people don't realize that there are treatments available. There are life-saving treatments to COVID out there. I think we're still just thinking we've got vaccines and that's what we've got. But really, we can build beyond that.
And if I might add, part of the problem is this physician explained to me is that when patients are in the emergency room and they're offering monoclonal therapies, because they don't know much about it, they are saying no. And there's a time limit to infusing a patient with this drug. And usually it's before you make it to the ICU. And then once patients are in ICU, and the doctor just texted me back and he said, let him know. And he's okay with going ahead with this. Once you know, I think, is it 72 hours, Chris or Mila?
I think, Jan, you hit it on the head, and so did Evan, by saying people don't even know what they're being offered when they're being offered it. And frankly, if they're being offered it in the hospital, at least they have people around them that can talk them through it a little. I think for the people sitting at home that are self-monitoring, it's even more confusing because now they're Googling. So both of you made really good points, and we're looking for more easy to understand information on this to share. And Chris is sharing a additional link here, but yes, Jan, you're correct. There's not enough awareness at all.
Okay,
And
well,
the awareness.
he just texted me and said he's willing to do it. So I told him we'll coordinate with his schedule because he's an emergency room physician. And we can get this, you know, promote this out to the community so that, you know, I mean, information is only as good as what people know. So this is something all of us can partner on. Great.
I would say that what information is available out there, and from our perspective, and what we need to do as this group, is it's probably not equitably distributed, right? I mean, we're probably pretty.
It's not great even in English right now,
right.
Let alone, and there's
right.
there's nothing, and yeah, no, like a big exclamation point on that, Evan. So yeah.
All right, thanks. Great questions, the right issues, and we have some solutions in the works. Now, I want to shift us over then. After saying, Chris, thank you so much. That's just an incredibly wealthy and helpful presentation. I want to invite Mimi now to share with us about data and building vaccine confidence in children.
All right, can you all see my screen? I'm getting to screen share here.
Yes.
Okay, just a minute. Okay, good. Are we on full screen?
Yes.
Okay, great. So Mila had asked me just to recap some of the pediatric findings from our focus group work because we didn't have quite as much time to go through it as we wanted to. Excuse me. And then to get into some discussion after that, I'm wondering if we kind of broaden that discussion because Jan and some other people have brought up issues in terms of what is our direction moving forward. So I would invite people to think broadly as we get to that point. Thinking of the pediatric cases, we know that the 5 to 11 vaccines opened up in the past month. So really the aims of our kind of querying around this were to help families feel comfortable and well-informed in their vaccine choices and to ultimately increase pediatric COVID vaccination rates in DuPage County. So we really used these focus groups as a forum to understand what were some parents' concerns about vaccinating their children, what do they need more of to make that decision, and just kind of recommendations from that parent voice in terms of what they might need. I wanted to provide a little bit of context before I dug into those focus group findings. And Chris, after looking at your presentation, I feel like this might be a victim of some of the IDPH data inconsistencies here because the numbers I pulled on 5 to 11 vaccination rates look much lower than what you had just shared. So I'm going to go with your numbers instead of mine. I like yours better. So let's just all do that today. And then I also looked at the COVID vaccine monitor because they've had some really good data out there and just tracking around what are parents' feelings around vaccinating their 5 to 11-year-olds. And we can see here on the far left that dark blue is parents who right away, I'm vaccinating my kid. What my takeaway from this is the largest group here is that wait and see group. So I think this presents an opportunity for us, for people who are in that wait and see camp, to use all the tools in our public health toolbox to persuade people to get their kids vaccinated. And hopefully that's a smaller job than we think if we have such great vaccination rates among 5 to 11-year-olds right now. And I would also like to just reiterate again that community settings and being in touch with people we know, those relationships that already exist through doctors, through schools, through things like that matter. And again, from the COVID vaccination tracker, we saw that schools that were promoting vaccines had much larger shares of their kids getting vaccinated, the 28 versus 8% of that age range. So just to bear that in mind as we're moving forward. And now I'm just going to recap some of those focus group findings when we were talking to parents about getting kids vaccinated. So we had 3 groups, just to remind everybody. We had a Black African-American group, we had a Latinx group, and we had a MENA group. We're really trying to get at some of our communities that are disproportionately impacted and make sure we're getting that perspective. Concerns that parents raised where they felt like they were making some of these vaccine decisions for their kids with what felt like limited information, and that was causing kind of a delay in making that decision. Really a sense to protect their children was at the forefront, and just this weight of feeling a sense of responsibility for making that decision, that, you know, their kids' health decisions are in their hands as the parent, as the caregiver of a minor, and just really taking that quite seriously and wanting good information to make that choice. Some of the concerns people raised, and, you know, all really well thought out, legitimate concerns. And I listed some of them here on the bottom half of this slide. They raised concerns about injecting vaccines in a still developing body. You know, this isn't an adult body, it's kids at various age ranges between 5 and 11. And are there unique concerns of vaccinating kids at that age versus adults? Parents raised the issue of vaccinating kids with special needs. One parent in particular indicated that she had a child with autism, and she has always kind of altered her vaccine schedule based on that, and that her child reacts a little bit differently to vaccines given their condition. And should there be guidance around the COVID vaccine for kids who fall in that group? Parents wanted guidance around, one, the short-term management. So what kind of symptoms can I expect for my 5 to 11-year-old when they get vaccinated? How severe will they be? How should I treat them? You know, what should I expect? Can they go to school? Things like that. And then also the long-term side effects, concerns about that continue to persist. We saw both for the adult population and the kids. So I have this vaccine. Should I be concerned that there will be some long-term impact of getting vaccinated on my body? Which is an interesting finding to me, that people are seeing the vaccine itself as a concern as much as COVID in some cases. So I think that's something we need to wrap our heads around, that there's some perceived risk to getting vaccinated. And then there was a subpopulation of parents who were already, you know, kind of like that 12% in that bar graph I had showed you early, who were pro-vaccine and ready to roll as soon as they could. Resoundingly, parents wanted more information about vaccines. They wanted hard information. I want the studies, I want the data, I want to know the effectiveness. Some common concerns that I think a lot of us have heard in our work, concerns around fertility for young girls and menstruation, myocarditis and heart concerns among boys. I have heard more around healthcare providers, not as much parents, also thinking about MIS, the multi-inflammatory systemic syndrome among children. So that might be something we want to wrap our heads around as well. And again, some of these points I already had indicated around vaccines in developing bodies and managing side effects. But I think this is an opportunity for us to really think about how people are making their decisions to vaccinate or not vaccinate their children, what information they need, and how's the best way to get that information to people so that they can really utilize it, and who are trusted sources of information. So what are some strategies we can use to move beyond, you know, passive information sharing? You know, something is present on a website is great, but how do we get it to a trusted source where someone can have a dialogue about that information and ask questions and get their answers, is also really important. I just wanted to recap. These are some of the quotes we had straight from our focus groups. So in our Latinx group, here are responses from 2 of our female participants. One woman indicated, despite knowing that the vaccine works for me or it works on adults, I'm afraid to put it in my children because their life is in my hands. It's hard to make that decision for them. So that idea of being really responsible for their children's health choices and maybe feeling like not having enough information to make a good choice, a well-informed choice. And this next quote speaks just to that. I would like to have information about the vaccination of children under 12 years of age. The results of the research, the studies are not well clarified. So feeling like maybe the information is out there, but it hasn't gotten to me yet. And I need that information to make my choice. From our Black and African American group, we again had 2 participants here who had kind of differing perspectives on this. So the one said, I've been getting my child vaccinated since he was born, and I haven't been doing any research on any of those vaccines for him to go to school. Also, I didn't hesitate because he's had a lot of vaccines since the day he was born. I just felt like it was necessary for him, and I took the chance. I would rather him have it than not. So it's interesting that some people are drawing a distinction that we've been getting childhood immunization since our kids are newborns, but we feel differently about the COVID vaccine for some reason, and drawing that distinction out. And then the second response is on the other side of that, a little more concerned about vaccines. I don't even like to give my child medicine. She has to be extremely ill, and that's very rare. When I initially got her a flu shot years ago, she was off and on sick for a year. When I discontinued the flu shots, she's really ever sick. So it's really difficult for me because we know when people just take regular medication, it comes with so much extensive side effects. So to think that a vaccination doesn't come with some type of extreme side effect, I don't think it's realistic, and it's just not enough information. So just this idea of, I'm just hoping. My daughter's like, oh, I want to get my COVID shot, and I don't know if I want her to get it. So just feeling kind of stuck in making that decision. So those are some of the direct quotes from our parents. And then this next slide, I just want to bring us back to this idea, and I would love to have a discussion about this, in that we have a lot of health behavior change models out there in the public health field. We have ones that are specifically being used around immunization that are addressing some of these factors that are playing into people's decisions to get vaccinated. So we're looking at things, around the psychology of it, around the social norms around it, people's attitudes, beliefs. So I'm wondering if there's a way that we can more intentionally marry that side of the research with all of the great epidemiological and monitoring data that Chris is giving us, every time we come on these calls. So how can we use these sort of 2 sides of the equation to inform each other and really craft a tailored response to what DuPage needs? So the one I presented here is commonly used with immunizations, the health belief model. And the point of this is to really, people are weighing their decision to make a health behavior choice on 4 factors here in this middle part. How susceptible do people feel they are to the risk? So how susceptible do people feel to getting COVID? How severe do they think that health risk is? I've heard anecdotally over and over again, oh, kids don't get that sick. But we know from Chris's presentation that it's one of the top 10 leading causes of death for kids. So we don't all make this judgment in the same way. Again, what are the benefits of taking action? What are the benefits of getting vaccinated? If I feel that the vaccine is just as risky as COVID, I might not perceive the vaccine as all that beneficial. And then finally, thinking about the barriers to getting vaccinated. Are there some of those real life barriers that stop me from getting vaccinated? Can I get to a vaccination appointment? Is it in my language? Does my community that I interact in, are they anti-vaccine? And kind of those norms are working against me getting vaccinated. So all of those things together are kind of that stew that people's decisions are made from in deciding whether or not to get vaccinated. And I would love to have a dialogue with this group about how do we tap into some of those concerns. Really, that's kind of it. I put some discussion and planning questions. We can start with these, or I know people had other questions that they raised, and we can kind of ad-lib this as well.
Maybe this is Chris. That's super helpful. And Mila, I'm thinking about, Kim's working on some of our health promotions teams working on communication stuff. And we tend to really focus on here's the benefit. It's so great. You should do it. And, we never want to be accused of fear mongering or making people more anxious about it. But I think you're right on some of the health belief stuff, like talking about the risks and then the benefits is helpful. and then working through the logistical barriers. It's really helpful to me to be reminded of that.
Mimi, I'm thinking a lot about those quotes, and
Yeah.
we've shared different, data points and different pieces of research and why, like to Chris's point, why this is so beneficial. But how well have we really acknowledged and explained what side effects are? And maybe do you feel like that is where we can do more? I'm trying to really kind of get into
I
how
think that's a
can we
great
address
question,
these
and
things?
Yeah, I think that is something that has definitely come up, both the short-term side effects of how do I manage, once I get the vaccine and, I feel like crap for a day or two or however, however long you don't feel
Right.
good. What do I do? What do I do for my child? And then also debunking that idea of there's a long-term negative impact. I think there's that fear, like what's in my body and does it rear its ugly head in some way later on? I think there's some conflating of the vaccine and the disease itself.
And to follow up on that, I think one of the things that we could do a little more on is the myocarditis and any of the, issues related to bleeding and blood clots and menstruation and things like that, because that comes up and people hear about those side effects and then it really reinforces doubt. And those side effects are real, so we need to discuss them. But how do we do that in a way that reinforces what the risk really is and how people can handle that? And those same things have come back up at boosters. Like, I got myself to the point where I didn't want to do the vaccine, but I did it. And now I have to walk through the same thing with a booster. How is that going to work for me?
I also think some of the stories of long COVID in kids, there's a couple mom groups in the area that when the mom has gotten on there and actually talked about her child with long COVID, the responses from other parents about it who are like, I had no idea. I just hear that it's a low risk, but you don't hear much about those continual side effects. And I think that's actually been pretty persuasive.
Yeah.
If I might just touch on what Andy wrote in the chat, we did a focus group with all African Americans, and half of the group were parents. These were vaccine resistant people. And one of the things that are findings, I should say, is the language of public health is muddled. So if you have already in existence a distrust of healthcare that is not just based on historical and ethical things that have happened, but the fact that in our current scheme of things, we still see that disproportionately hazard outcomes impact vulnerable communities more than they do the dominant population, that distrust becomes that much more real. And a discussion I had recently with a clinician down at Rush, we talked about the importance of health literacy, improving on that. And one of the things we did at the very beginning of this focus group was a word association, very playful test. 100% of the participants did not understand the language that we are using to explain this virus. So they are resistant based on what the misinformation, the disinformation that is flowing through social media. When we came back with part B of the focus group, and for those of you who don't know, part A was we listen to you, part B was we have a discussion. And in that discussion, we literally listed every word from that word association and the definition. And Dr. Wilson from Edward Hospital was on to explain and to address their concerns. The result of that was at the end of session B, 70% of the participants were no longer vaccine resistant. So what does that say? The resistance is based on them not understanding SARS-CoV-2, not understanding coronaviruses, not understanding what is morbidity, what is mortality, and in the backdrop, not having good relationships with physicians because of cultural incompetence. These things are very real. And in fact, I began writing my report, and as I dug deeper into the research, which is why I've paused it, because I found that, and as we know from surveys that have been done in DuPage County, we do not get a really good response, especially from African Americans, but from other minority groups as well. And which is why we've taken this position of let's look at focus groups, let's talk to smaller groups of people and really listen to them, not just validate what they say, but give them the respect that they are old because of the history, if nothing else. Give them that respect and give them that safe place. And this came out in a meeting with Nicole and the folks down at Good Sam. Give them that safe place to voice their concerns. And I'm thrilled on one hand that when we did the exit survey, 75% of those attending said they are no longer vaccine resistant. So I want us to go forward here with an eye for how do we improve cultural sensitivities? How do we address and the folks you talked about at the beginning, and when you introduce yourself, who don't trust caregivers, where caregivers are not in the best place to build those relationships. How do we build relationships in our communities, in the DuPage community, that will improve health outcomes, opportunity for optimal health outcomes?
Well, I could go
Go
all
ahead,
the way back. I could go all the way back to how LGBTQ people feel about getting into medical school, but that's probably not the hill I need to die on here. I think encouraging more physicians to become culturally competent, which is not currently done, especially within the LGBTQ communities. There are trans people here who are so afraid to go in a doctor's office. It's just unreal. They'll talk to me because I'm LGBTQ. So what we have to do is make sure that more Black, brown, and LGBTQ and any other minority group we can think of step up and have these focus groups. Mimi, I don't know, maybe we should have more television involvement, public service messages. But I think along with Janice, that the real thing is getting people in small groups so that they can feel free to ask questions and get answers and get it on a level that they can understand. You know, in my entire career as a nurse, a lot of it was spent in South Carolina, where people were poor and uneducated. And those people exist in DuPage County. People might not want to acknowledge that fact, but they're still here. And even people who are fairly well educated may not know medical terminology. But if you've ever had to go behind a doctor and explain to somebody what was wrong with them, or if a doctor goes in an emergency room patient and asks, do you have this, and this? And they, nope, I don't. And you go in and you ask, do you have high blood? Do you have high sugar? Yes, 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 yes. But they don't have diabetes or hypertension because they've never heard of it. we're adding even more technical stuff on top of that with the vaccines and the vaccine process and developing vaccinations. And it's too much for a lot of people to comprehend. So they're just against it because they don't understand it. And when you take a group like African Americans who have been dug up out of the grave and tests run on them, and I mean, it's a horrifying history that we've got to overcome with people.
As I listened to the series of comments that kind of string out of the focus group findings and Mimi, the health behavior model, that's what you called it. Am I saying the obvious that it appears that the focus groups are a place where we're in undertaking a health behavior model intervention, we're improving health literacy. Perhaps there's not a direct input there on physician cultural competence, but that could be improved too. Where I'm going with this is the importance of that dedicated time and relationship. And I'm not a public health professional or a communications professional, but in my other roles, I read a study a few years ago by the CDC that looked at vaccination messaging way before COVID. And they tested this idea of a myth-fact juxtaposition in public messaging. And does this ring bells with anyone? The stunning result is that for the first 40 minutes after the messaging, the respondents understood the value of the vaccine. But once 40 minutes passed, the myths restored their prominence in the person's beliefs and understandings, and in some cases excelled. That is, in some cases, the testing itself was introducing new myth information that people held on to, even though they'd been told the facts. And the antidote in this study was you must only present the bad information in a context where you've got somebody's attention and they can do the cognitive processing to evict it, to put it in a place where it belongs. And it sounds like focus groups structured the way that you mentioned them, Jan, do that. A lot of good stuff happening there. We're not just learning, but we're having incredible progress in people's thinking moving forward. I wanted to follow up on the health behavior model slide, Mimi, to ask you, thanks, Evan, to ask if it might be worthwhile for us to do a little study, investigation, or learning there about how does that, what's the practical implication model for that? Is it done through focus groups? Is it done through public health navigators? Who does that work, and how do they engage people?
Yeah, there are actually interventions, and I mean, my background originally in this is more in the HIV arena, but there are interventions that take these health behavior change theories and then craft interventions. So for example, like a popular opinion leader model pulls from this health behavior change theory and would be such a great fit with, for example, like the vaccine champions, because the point of it is to really identify trusted community sources of information. So it's not a public health expert, it's someone in your community who you know and trust, and they are training those people to provide good information right within their community. So it's my friend, it's my neighbor, it's my whomever, but that person has been trained to provide really good information.
What I'd like to do, we have just a couple minutes left, and I'd like to kind of shift gears, do a shift, building on what we've just heard. It's important for us as a work group to be thinking strategically about the future. And I'm going to incorporate something Mimi said. I want to make sure that we address Jan's kind of global question, but I'm going to take you through a couple of slides very, very quickly here. Let's see if, are you able to see my screen?
Yes.
When we got together 13 months ago, we had a call to action and charge to reduce the disproportionate burden of COVID, to broadly address health disparities and equities, and to develop a strategic plan that could be measured. And in July, we took a moment to reflect among ourselves about what's the value that HEART has brought. And we learned that this is a good place to learn from other leaders, to work together on solutions, to understand new issues that we may not have been understanding ourselves, the value of relationships, the value of up-to-date information, the opportunity for working together to come up with solutions. The visibility of diversity in the group is a strength. The speed in which we've been able to make changes and take action, and the discovery of resources that are helpful to our constituents and we can bring back to our organizations. We have done an incredibly good job of focusing on the COVID response and the disparities there. We also had this charge and have the charge to think broadly about health disparities that are impacted by COVID. And Julieta helped us in July when we did this summary of what's valuable. She also raised the question, well, what about the problems coming up? What about the eviction moratoriums that are coming to an end? What's that going to do to us? And Mary, when I see you on our call, I think you are anticipating a whole wide range of things that are already happening and on the horizon. It's important that we also assess what we're seeing in that regard. And I will not take the time today to do this, but I commit to work with Mila to put together a very brief survey to ask our members to reflect a little bit on these categories of risk around social determinants of health to help us think about what we could be focusing on in our future, in our strategic future as a work group. And I had Mimi kind of primed to do a look at the role of data in HEART as we move forward. And Mimi, I wonder if, I appreciate you did some thinking about this in advance. You and I had a conversation about how can data lead us to action. We've really lived that out just now in our discussion. I wondered if there was anything else that you wanted to add before we closed out today.
I think we've hit most of the high points. I think the biggest take-home message is we have this great surveillance and monitoring data. I think we're coming up to speed with more of that, what I'm going to call kind of the voice of the people. So understanding what are people's hesitancies, what are people's concerns. And I think we have work to do in marrying those two pieces, but I think we're getting there.
Very good. Thank you. Jan, I wanted to be sure we touched on your question about a shift of message. We're at 10:32, and if folks are able to stay with us for another 5 minutes, perhaps, or Jan, do you think we can address your question in that time? You asked about a shift in our messaging.
Where do we see our focus should be right now?
You had a specific juxtaposition, and I think I have it here in my notes, but I'm not finding it right now.
I mean, we've been focusing starting about a month ago on the vaccine resistant people, but Chris, looking at the numbers, part of me is thinking we still should continue to address our vaccine resistant community members, but also begin to more seriously push boosters for those in our community who are vaccinated already, which is what we're planning to do, right, Mila, with the vaccine clinics over the next week or so. And I'm guessing we got the North Central one scheduled.
It sounds like it. I have not talked to Andrea this morning, but yes, it looks like it's well on its way.
And I spoke with with one of the executives over there, and I'm sure North Central is not the only school, but there is a growing concern for what's going to be the impact if our numbers continue to, our COVID positive numbers continue to rise on our schools. So do we become more proactive here?
Yeah, Jan, I think the vaccine stuff is so important, and not giving up on people who are hesitant because they have little to no protection versus those who are fully vaccinated and still need boosters. So I want both of those. And from a public health lens, the idea of protecting, reducing transmission, period, right now, no, you're not likely to be hospitalized or die, but until we get these transmission numbers under control, it will continue to be disruptive for school, for work, for family gatherings. So I hate to go back, prioritize reducing masks and testing and social distancing are critical tools, but I feel like right now these numbers are skyrocketing. And if we don't bring those cases under control, we're not going to get back to normal anytime soon. So I would suggest the vaccine efforts and then just reducing transmission.
I would pick up when I think about all the messaging that's out there, that slide that showed the disparities on boosters getting into arms of folks who are not white or Asian was pretty stunning. So I know I'm going to want to go back and look at everything that we're doing that's promoting vaccine or boosters and say, what's missing in this booster strategy that needs to attention? Because it's not, I'm not thinking about it as bumping anything else in importance, but that's one that is kind of calling out an urgency for us to retain equity in our community.
Hey, Dave, I think looking at that, I'm going to talk to Kim and see if we can bring some of our vaccine champion videos back out and kind of start circulating those again. And I want to share my screen if I can real quick and show you something that's geared towards the 5 to 11s, if you guys have a minute. But also, Jan mentioned a clinic at North Central, and there is one tomorrow, Saturday, in Warrenville. And those are, open to the public, and they're working at a good pace there. The wait has been really minimal, if any, and it's been really smooth. So I would really encourage people to promote those. I know you guys all know about them, and you're all great champions, but the more we can promote them, you can simply go to the health department Facebook page and share it from your organization page or your personal page and get that kind of word out. But we'll start circulating the vaccine champion videos and things again. And what I'm going to show you now, if I can, is something that Kim just recently developed. So can you guys see this? Okay.
Yes.
Okay. So I'll give you more on this, but we have different poster sizes and different fact sheets developed that are really geared toward the 5 to 11-year-old vaccinations. And this is the Spanish one. We also have it developed in Mandarin and in Urdu. And obviously we have one in English. But for you guys, I think what I'm wanting to hear, and I'm just kind of scrolling through it so you get a look at it, is before Kim goes further to package it up into a toolkit, are there things that you would use and how would you use them? Would you prefer to pick up posters that are printed and ready-made? Are digital pieces easier for you to use? So I think for us, we want to go ahead and get these out to you. We're going to talk to our libraries, hopefully Monday. And of course, we're coming up on holiday time and kids on break and schools, out of session. But in a way, that's a good quiet time, right? So if we can get the attention of a few people, we can get these going. So, we have a really nice group of graphics here that are representative of, of different cultures, and they're going to be great to share. But I think what we need to know from you is, how would you use them?
Our work is supporting agencies, so the electronic transmission is very important to us, for them to be mobile, transportable. I wondered, Mila, also, we have a great partner who focuses on Arabic speaking community, a nice pathway there. Is it possible that this could be translated into Arabic?
I think Kim is working with Dr. Asfar on some of those. So I will ask her specifically about Arabic. I think they discussed Urdu, but let me get back with her to make sure I'm correct.
And Mila, I could make sure, again, similar to David, electronic submission, that all of our DEI and parent groups throughout our various school districts will have a copy of this. And being on the steering committee for DEC, our early childhood learners, I can definitely make sure and commit to the flyers getting to our educators so that they can give them to the parents. Is that okay?
Yeah, that's great. And so, Jan, are you saying digital?
Yes.
Okay. So this is an English speaking version. There's a couple things that we're going to target toward medical providers or vaccine groups. I know this is a lot of color and I'm scrolling fast. Hopefully you're not getting a headache. But there's a certificate in here I'm trying to find. So this, can you see that? So, this is something that they can use for younger kids that I think is fun. And, I kind of wish we did this for all vaccines now. So, just different ways to reinforce the positives. And I think while it's really important to share all the heavy details on the medical benefits and all those things, sometimes we forget about, just going at this from a pure health promotion message that people can relate to.
Would this replace the, I'm sorry, would this replace the CDC card?
Oh, no, no.
Okay. Well,
This is just a fun ad. I think the schools would be very upset if we didn't have parents giving that card.
Dr. Jorgensen, our friendly coroner, and I had a discussion. And because he attended some event where people actually had nice little pins to say, I've been vaccinated. Mm-hmm. And I brought that to our superintendents and their staffs when we planned the one shot, super shot thing in Naperville. And I learned, I'm just sharing this, that because, and especially with some of the groups that are anti-vax, mm-hmm. that a lot of the parents are not willing to let their children advertise that they've been, because we wanted to do something very similar to this, that they would not be willing rather to have this advertised because of the those who are opposed to it they may get flack. So just sort of keep that in mind. I mean,
no, that's a good thought.
Nice to me.
Okay, that's very important to keep in mind. I think this is planned to be a certificate, but I wonder if they can make it into a sticker, more of a sticker or something. We're looking for options. So I think most importantly, what I want to know, and you can send me an email because we're getting really lengthy here, is would you, how would you use it? Send me an email, let you know, do you want posters? Do you want digital pieces? This is a fairly large, I can't email this to you. It's a really big file. So Kim's going to break this down into a toolkit that you can download off the website. And if you go to the website, you'll already see some of these graphics there next to the caravan schedule. So, which I did put in the chat there, but the fight continues. I think these are nice pieces, and I just want to know from you guys, how can we help you get them out there? And just know we'll be talking to libraries and our community groups over the holidays, but really kind of doing a full push to be ready in January.
Mila, are you working with food pantries?
We're working with the Hunger Network.
Okay.
So, yes. So, and again, this is a kind of a crazy time for them. They get real busy before the holidays, and then they go a little quiet in between. So yes, but we are working with them, and we'll continue that. And I think for this particular piece, we're going to kind of reach out to our daycares too and see if this is something that they would like to have.
Okay.
And I see Jen Laddish talking about door hangers.
Oh.
So, and she's added some more in the chat here that I haven't had a chance to look at yet, but that's a great way to get multilingual information about vaccines out.
Yes, that is a great idea. I'm looking at this. Good.
Yeah, and
go ahead.
It would be amazing. We have actual physical door knockers that are cardboard that we can hang, but we also have little plastic bags that we can put everything in, go to certain neighborhoods, leave them on the door, on apartments. I've been delivering things to some neighborhoods that I'm seeing an uptick in cases where we're delivering, and it would be great if we could put something on the doors. And then I just saw somebody mention about petitioning. Petition season starts next month, in the middle of the month. And so a lot of precinct committee people will be out door knocking for signatures, and it would be a really great opportunity to partner up and give them information to hand out too. I'm a PC, so I totally get that. And, we could pull that together to have information to hand out too, because PCs will be all over the county. So it would be a great partnership to help with this.
PCs for vaccine confidence.
That's right. That's right. There you go. It would be awesome.
Thanks, Mila.
No, thanks for the extra time.
Thank you all for the extra time. We have gone over, and thanks so much for your contributions to this meeting. The number of connections and solutions and actions created is fantastic. We don't have another meeting set yet. I don't think I'm going to risk putting a date out there, but we'll get our heads together and send one to you. Thanks so much for all that you're doing. Thanks for equipping us to be able to do, to amplify your work. I wish you all a really good weekend. I wish you all a fantastic holiday time, and look forward to seeing you again soon. And I declare us adjourned.
Happy holidays, everyone. Thanks, Dave.
Happy holidays.